Now, this disease, which we surmised early on, started off in the male homosexual population in this country. Not that there was anything intrinsically different or wrong or what have you about homosexuality. It was very simple. It's straightforward epidemiology. You take an infectious agent and you introduce it into a population in which the spread among those individuals, if it's sexual contact spread, it's a perfect setup to spread.
You will not be able to stay home, brother. You will not be able to plug in, turn on, and cop out. You will not be able to lose yourself on Skag and skip out for beer during commercials because the revolution will not be televised. The revolution will not be televised. The revolution will not be brought to you by Xerox in 4 parts without commercial interruptions. The revolution will not show you pictures of Nixon blowing a bugle and leading a charge by John Mitchell.
Now, this disease, which we surmised early on, started off in the male homosexual population in this country. What we had was a concentration of cases, as you'll see here, in the New York metropolitan area, New York City and New Jersey, and in Los Angeles and San Francisco in California. Some of the data that I'll be showing you now is based on the first 4,000 cases. Historically, we first recognized this disease actually as a new disease in 1981. The cases were first brought to the attention of the Centers for Disease Control, or the CDC, in 1979. In the summer of 1981, there were reports of unusual infections and or tumors in otherwise healthy homosexual men. Now again, if I were giving you this lecture when we started working on AIDS a few years ago, I would be spending the first 10 minutes or so trying to convince the audience that we were dealing with a new disease. In fact, we don't need to waste any time on that. This is a new disease, at least in the United States. Where it came from, we'll discuss in a short while.
A few minutes later.
Now, what about the geographic origin of AIDS? What I'm going to tell you in the next couple of minutes and in these next 2 slides is scientific data, and I'll tell you what the data, and then some speculation. The scientific data is that AIDS exists in Africa, in Central Africa, particularly in Zaire. It exists in a rather substantial way. The incidence of AIDS in Zaire is as great as it is per 100,000 population as it is in San Francisco. If one does epidemiologic study by examining the sera of individuals in Africa, we know that the disease existed there in the early 70s, before it existed in the United States. Is then Central Africa the source or the origin of AIDS in the United States? I don't know that. I don't know that. Now we're talking about hypothesis. Let me tell you another fact. In the late 60s and early 70s, thousands, not a few, but thousands of Haitians came to Zaire, particularly in Kinshasa, the capital, to work as technical advisors for the Zairean government. After several years there, because of the nationalization of much of the industry, they were essentially kicked out of Zaire and came back to Haiti, to the United States, and to Canada. Is that a possible connection? The answer is yes, because it is very likely that the male homosexuals in New York City, who frequently traveled to Port-au-Prince in Haiti for vacations and for sexual contacts down there, picked up the virus in Haiti, and then because of the mobility of the population between New York and the West Coast, there was spread back and forth from the West Coast. In addition, the early cases in Europe, in France, the early cases in England and in Germany can be clearly traced to homosexual contacts from individuals who resided in New York. But there's also a very important clue there, because most of the cases in Belgium, in fact, were among black Africans. Belgium, in fact, were among black Africans, black Africans, black Africans, black Africans. Black Africans who had come from Zaire and had gone to Belgium for medical assistance. As you probably know, Zaire was formerly the Belgian Congo, so there's a great deal of link between Belgium and Zaire. That was the first clue that perhaps the disease might have originated there. So we don't know really scientifically where it originated, but a series of circumstantial happenings strongly suggest that this may have been the original focus and how it happened to get introduced into the male homosexual population. In the United States, 71% or more of the individuals with this full-blown AIDS now are homosexual or bisexual men. 17.5% of them are intravenous drug users, 4% are Haitian, a little less than 1% are hemophiliacs, and about 6% of them don't fall into any of the known above risk groups.
All right, what's up, family? So we see that in 1984, when Dr. Fauci took control of the National Institute of Health and the NIAID, so infectious disease control area, AIDS came in due to Robert Gallo and their research in the 70s. He made a lot of misleading statements. He was very understanding and complicit verbally and with his language, trying to get that negative stigmatism off of the, at that time, homosexual was actually considered white for the most part. When you said homosexual, you were talking about predominantly Caucasian community. And he made sure that he took the stigmatism off of them and put it onto black Africans who did not have the population at that time. He bent over backwards to make sure that you thought about black people when you seen AIDS, because he was in a position to make that true. And that's what he did. He made sure that Africans, him and others, made sure that black Africans had so much AIDS to show, to try to mask the fact that the pandemic of AIDS and HIV was deliberately placed in centers like New York and San Francisco, and even in Belgium. But the main thing is New York and San Francisco. So now we come up to today. Who has AIDS? This is in 2018, 37,000 people received the HIV diagnosis. Who's at the top of the list? Black African Americans. We weren't even on the list in 1984 when this dude was talking, and we definitely wasn't really on the list in 1979. because we know where it started. Okay? It began in the homosexual community, the white people, at that time. And it's still there. But since they're turning a lot of black folks into homosexuals, we see an increase in that number as well. So we see that black represent the highest cases of HIV/AIDS. You can look at it here. These are new diagnoses by 2018 by age. And by age, you're getting very prime people between 20 and 35, 25 and 35 years old, getting AIDS. And look how many you got getting AIDS before they're even 25, at 13 years old and stuff, getting AIDS. You see that? Let's look at this here. Black people are the face of AIDS. And then you got Hispanics, second. AIDS. But we don't hear too much about them, but they're there. And we see whites are still big time in AIDS because, you know, this is where it started, okay? And, you know, that's the main thing that we need to take from. You can't say that this man is this man is trusted. You know, this man is such a great success story when he had 36 years to clear away the AIDS pandemic, and he increased the AIDS pandemic. There's more new cases of AIDS now than it was when he first got in there. That first year when he was talking in 1984, they were talking about 4,000 cases of AIDS. That's a joke right now. New diagnosis of AIDS, 37,000 people after all this time. You see, this is how they institutionalize one virus. They've institutionalized AIDS. And viruses come and go. It's like the Spanish flu. We didn't have all that technology. It killed people. It came and it went away. And just like cytomegalovirus, you know, the thing is, what they're doing is they're institutionalizing coronavirus. You know how many people, like a cytomegalovirus can make you go blind. It can give you lesions all over your body, similar to like a herpes strain. But no one knows. Most people have cytomegalovirus by the time they're 40, or half of the United States have it by the time they're 40 years old. You never know it because you have a normal, healthy immune system. Okay, there's trillions of viruses that you have on you and in you, but you don't know it because you have a healthy immune system. It's the same thing with the coronavirus. It's something that our immune systems can beat. But what these people want to do, they want to institutionalize diseases so that they can continue to eat off of this disease with their medications.
I just want to make a brief comment to get back to the discussion about the health disparities in the African American community, because it really is very important. And the reason I want to bring it up, because I couldn't help sitting there reflecting about sometimes when you're in the middle of a crisis like we are now with the coronavirus, it really does have ultimately shine a very bright light on some of the real weaknesses and foibles in our society. And as some of you know, the greater proportion of my professional career has been defined by HIV/AIDS. And if you go back then, during that period of time when there was extraordinary stigma, particularly against the gay community, and it was only when the world realized how the gay community responded to this outbreak with incredible courage and dignity and strength and activism, that I think that really changed some of the stigma against the gay community, very much so. I see a similarity here because health disparities have always existed for the African American community. But here again, with the crisis, how it's shining a bright light on how unacceptable that is. Because yet again, when you have a situation like the coronavirus, they are suffering disproportionately. As Dr. Berg said correctly, it's not that they're getting infected more often, it's that when they do get infected, their underlying medical conditions, the diabetes, the hypertension, the obesity, the asthma, those are the kind of things that wind them up in the ICU and ultimately give them a higher death rate. So when all this is over, and as we've said, it will end, we will get over coronavirus, but there will still be health disparities, which we really do need to address in the African American community.
All right, so let's look at this here. So if you listen to what Anthony Fauci said and how he positioned his wording as it referred to the homosexual community way back in 1984, and if you listen to how he just used similar language as he was reflecting on the coronavirus statistics, I'm going to believe that he sees the opportunity that he benefited from the decades and decades of stringing people along, institutionalizing one virus called AIDS. That was created by a guy named Robert Gallo, according to rational claims, allegedly. This AIDS disease was institutionalized, and that man made a lot of money off of that. The medical industry in America made a lot of money off of institutionalized virus treatments. Not cures, treatments. Okay, you have people like Dr. Sebi, and others with alpha interferon with the Nation of Islam, alpha interferon, and others in Cuba treated AIDS patients, cured them, because AIDS is simply the destruction of the immune system. And once that immune system is restored, then, that's done. That's all AIDS is. So these people, though, they are not interested in treatments that cannot be patented. And that's Dr. Fauci. He's the one that has the budget and is pulling a lot of strings for that. If they can't patent a disease, just like you can go find out there's a patent for coronavirus 19, there's a patent for AIDS, okay? But if you can't patent treatments, you can't patent the disease, then they're not interested in treatments such as increasing the immune system with vitamins and other treatments, okay? So I want to show the question that he was responding to, and let's go through this here. It was done by a black woman here at the, and this is the conference, or the coronavirus press conference on April 7th.
Follow up, you talked about African Americans and how they've been disproportionately affected by the coronavirus.
Seems to be, unfortunately.
Do you plan on requiring the CDC, any federal agencies or state agents, public places doing tests, and private companies doing tests to collect that data on the race of the people being tested and the race of the people being treated and the outcomes?
Well, we're just seeing tremendous evidence.
And what I want to do is say to the black folks is we have to start learning how to collect our own data and trusting our own data collections. Okay, so we can't be dependent on
white people and their institutions to collect our data and then tell us what it means. You know, because they pick and choose, because they create certain narratives, because they don't want you to have power. And that's why they're watching.
Well, we're just seeing tremendous evidence that African Americans are affected at a far greater percentage number than other citizens of our country, because we're dealing with our country. Now we're looking at it from a worldwide standpoint. Tony Fauci is looking at it very strongly, but these numbers have started to come out, and they're very strong, and they're pretty obvious. I mean, you're talking about...
You will release that.
Would you like to talk about that for a second, please?
I think one of the things that we're going to be doing with our Medicare data is to do that analysis. We're going to look back at the last month or so and look at, related type illnesses going forward. We now have a code for coronavirus, so we can actually stratify by demographic information, so we can look at race as a factor. We can also look at what the underlying health issues are as well. So we'll be providing that data very shortly, but we will be doing that analysis.
We're working on that. This is something that's come up over the last, I hadn't heard this, and then over the last few days this has come up more and more. And I don't mean by a little bit, I mean many times. It's a real...
So notice that point. See, he said this is something he hadn't heard about. This is the president, he hears a lot of information. And over the last few days, from April 7th, and keep in mind, in March, the Asian community, was stigmatized with, and they were pushing back from the stigmatization of the coronavirus, because in March, during the March season, this is when Asians were being fighting back from the stigmatization of, it was called the Chinese virus, and they made that a hate crime. They basically made, they didn't want Trump to say that, basically, and they bashed him about using that wording, Chinese virus, because no community wants a stigma. You see, stigmas make stereotypes, and negative stereotypes make it harder for everyone to do business. See, this is one thing that black people don't understand. So even if someone is speaking a truth, okay, you don't want it to be spoken in a way that stigmatizes a group. Because if that was the case, we can stigmatize all kind of people. There's all kind of disparities if you want to talk like that.
Now, we want to find cures, we want to find therapeutics, we want to find vaccines, because that will solve everybody.
Now you see that? No one in the medical industry is saying that. Cures, therapeutics. Now, a vaccine is not a cure. A vaccine is something that you can patent and you can make money off of every year by keep bringing the same disease back. But what we're trying to talk about is cures, therapies, okay? And I know y'all, a lot of black folks, for some reason, you've been trained to hate, Donald Trump, which he is a racist, because he, did think, as far as Central Park 5 and some other crap that he's done with doing racist stuff, but, beating up black people in his rallies and some other crap that they've done. But at the same time, that language there, cures, therapy, that's beneficial to what our objective is, what would be beneficial to black people. So,
that will solve this problem. But why is it that the African American community is so much, numerous times more than everybody else, and we want to find the reason to it? And Dr. Fauci, STIGMA, both of them, and others are working on this, and they're going to have very good, I would say in less than a week, I think you're going to have very good statistics. Couple of days.
Something specifically aimed at those communities that are being hard hit, those black communities.
Well, we're helping them a lot. But what's happening is we're trying to find out why is it that it's 3 and 4 times. Now, maybe that's not going to be the final number, but why is it 3 or 4 times more so for the black community as opposed to other people? It doesn't make sense, and I don't like it. And we're going to have statistics over the next probably 2 to 3 days, okay?
Mr. President.
3 days, okay?
Mr. President.
All right, so that was the question that this guy, Anthony Fauci, is responding to back here. Now I want to go back here and listen to this piece of crap. Now he thought about that question, and you know, Donald Trump's, from the numbers that they were telling him. Now keep in mind, the reporter asked for that information to be released, meaning we didn't see it. We didn't see these statistics. We did not see the statistics. But from what he was being told as the president, 2 and 3 times more likely to affect Black Americans, the coronavirus, than white people. That's what he was being told or made to believe. Keep in mind, he's privy to this information. The reporter, this is a White House press briefing, she's asking for that information to be released to the public because we didn't see it at that time. So keep in mind, it
does have ultimately. I just want to make a brief comment to get back to the discussion about the health disparities in the African American community.
now, what I want to say about this health disparities thing, Black people, we need to be in control of our narrative, how the world sees us. Okay, they always want to highlight disparities, a disparity, you know, like you're desperate. You guys are always in need. Something wrong with y'all. Okay, and this is some kind of language we don't want. We should be pushing back on that, especially the more intelligent and educated in our community. You don't want people to define you as disparity, a pitiful bum. You know, that kind of language is not respected. You know, because I can define all kind of people as in a disparate way. You know, I can define, you know, elderly as disparity because the elderly are getting affected by this disease more than younger folks. I can define, you know, men, what they call males, are getting affected more by this disease or any diseases. You know, Tay-Sachs disease. You know, there's other issues like the Asians, even though they eat bats and crickets and jellyfishes and all these type of diseases, they don't want to be defined by that kind of rats and rodent. They don't want that to be they don't want you to see them as this, that. So we got to be careful about allowing people, other groups, to define us as in some type of negative light. So, you know, that's one language that I want us to kind of focus in on. This is why this man belongs in the trash, because he knows what.
Because it really is very important. And the reason I want to bring it up because I couldn't help sitting there reflecting about sometimes when you're in the middle of a crisis like we are now with the coronavirus, it really does have ultimately shine a very bright light on some of the real weaknesses and foibles in our society. And as some of you know, the greater proportion of my professional career has been defined by HIV/AIDS. And if you go back then, during that period of time when there was extraordinary stigma, particularly against the gay community.
So let's look at this right here. So I want you to listen to his language when you talk about the stigma in the gay community. He understands what a stigma does. And this is what Black folks don't understand. A lot of Black people, obviously, because I'm getting messages on Facebook and on different platforms where people are arguing, oh, Tony Fauci is telling the truth. He's such a great, listen, this man here is stigmatizing you, but he's doing it like Hillary Clinton and Bill Clinton. He's just doing it with a smile. And for some reason, you want to trust him. Don't.
And it was only
And it was only when the world realized how the gay community responded to this outbreak with incredible courage and dignity and strength and activism that I think that really changed some of the stigma against the gay community, very much so. I see a similarity here because health disparities have always existed for the African American community.
That's a lie. Black people were not, you're talking about health disparities have always existed. Now, if you want to take the absolute technical term of what a disparity is, then yeah, disparities exist among all communities. Different people are affected by different things. But health disparities, black people were very healthy, okay? And white people were considered unhealthy. Black people tended to live longer. We often reached 90, 100 years old and in good health, so this guy needs to, that's not true. Health disparities have not always existed within the black community, but they are intentionally poisoning our people, okay, with these kinds of, and see, that's a half truth as well. When you put this air pollution factories, you put experimentation, and you put runoff of factories, giving people cancer, targeting communities with drugs, alcohol, and cigarettes. Of course, you're going to start beginning to see these kind of health issues pop up in people's communities. You restrict them from good vegetables and clean food and stuff like that. So yeah, but that always was not the case. So we just need to just kind of get what this dude's.
But here again, with this is how it's shining a bright light on how unacceptable that is. Because yet again, when you have a situation like the coronavirus, they are suffering disproportionately. As Dr. Berg said correctly, it's not that they're getting infected more often, is that when they do get infected, their underlying medical conditions, the diabetes, the hypertension, the obesity, the asthma, those are the kind of things that wind them up in the ICU. And
so listen here, he just told you right there, it's not that they're getting infected more often. Now this is the key point. So black folks, we need to understand, we're not getting infected with the coronavirus more often than any other groups of people, but that we are not being treated the same when we get infected. Okay, so get clear. This is what this man is saying, because you can't prove in the statistical numbers that black folks are getting coronavirus more than somebody else. In number one, in fact, you can realize that we were not getting it in the beginning of this issue, when they started announcing it. We were not getting the coronavirus in those high numbers like Asians and like, the white people were getting it. We began getting it later. And this is the reason why early on people were saying, oh, black people can't get it, because we weren't getting it. So
typically give them a higher death rate. So when all this is over, and as we said, it will end, we will get over coronavirus, but there will still be health disparities, which we really do need to address in the African American community. Thanks.
So that's my point there. This guy, he wants to put health disparities on the African American community, and we need to address that. So what he's doing is he's taking the focus off of the Asian community, and he's putting a big fat disparity, a big fat stigma on black people. So now when we see stuff like in New York Newsweek, I should say, it says 81% of New York Police Department social distancing summonses were issued to blacks and Latinos. It's the new stop and frisk. So you can tie that, and you see other issues. You can tie this kind of policing, because when this is a policy maker, this guy Fauci, that's what he does. This is what he's doing. He's creating policy and he knows the kind of languages to speak. Look at this. I really don't understand the meaning behind this picture here. 81% of NYPD social distancing summonses were issued to blacks and Latinos. It's the new stop and frisk. So you got the blue foot, and I guess it's going to take the collar away, and you got a white couple in their house in the suburbs, I guess. The point is, they're targeting black people, okay, removing, I guess the cow would be us, the cash cow. I don't understand how that, see, this is all targeting language, all of these symbologies. Black folks, if we don't understand this, how to look at symbolism, this is how white people communicate a lot of messages, through symbolism. But so basically the bottom line is, of 374 summonses issued in regards to social distancing, the respondents of 193 of those summonses are black. So that's over half are black alone. And the respondents for 111 of those are Hispanic, which includes black, because Hispanic is not a racial group. It's just a designation they created to compete with black, basically. Okay, so Hispanic is not a racial group. It's the new form of stop and frisk, and stop and frisk is a racist policy. Okay, so I'm not going to go into all that too much, but the bottom line is, black folks, we need to understand that this coronavirus thing is a big cash cow for them. You see, the way that they're selling this thing, they actually pay, with the CARES Act, they actually pay 120% for all treatments to the hospitals if the patient is listed with coronavirus. So if they attach it, or the deaths, they get all kind of benefits simply because things are listed as coronavirus. So no wonder this particular meme here is very funny nowadays. See, orders from the top. This is a purpose here. This is policy, the way they're using this. Even though the facts remain, orders from the top. Everyone dying today died of coronavirus. It doesn't matter what, there's no other diseases now except coronavirus. This is a fact. 99.98% of the people are not, hurt by coronavirus. And it's had months and months and months and months and months from coast to coast to affect everyone. But they shut the economy down because it's a big PR campaign to scare everybody, because they want to force compliance. And they want us all to force the compliance on each other. So, they legitimize certain information, and certain information is not legitimized. They're trying to scare you. Look at this. This appeared right on CNN. They're telling you total cases about, look, right at this point was less than 3 million. Global death toll approaches 3 million. See, this is total cases. This is deaths. Okay, in the world. 206 at that point in time. Total cases in the US was about 1 million. Deaths at that time was 54,000. These numbers are not, they're scaring people. But here they wrote, global death toll approaches 3 million. I'm just saying, this is just something we got to understand as people. We got to learn to let these people just, I don't know, let them fail in their ability to scare us. And tell me what you think. All right, y'all. Peace.